four wonderful athletic trainers speaking tonight on spring sports. Just a heads up, you will not be able to unmute during this event, so please use the chat to communicate any questions that you may have throughout the presentations. The chat will only show questions to the panelists, so we will ask those aloud after each presentation is completed. After the event, you will receive an email with a link to the quiz, and you will have 1 week to complete this. You must complete the quiz in order to receive the CEU credit, and you will then get a certificate of completion sent to your email. Make sure to use the email that you signed up with for this event. I'd like to extend a big thank you to the MATA for sponsoring tonight's event. This is one way that the organization is giving back to its membership. And before we get started, I want to remind everyone about the upcoming MATA Symposium and Business Meeting on April 11th and 12th. You can visit mnata.com for more details. Our first speaker of the night is Ronni Beatty-Kollasch. Ronni joined the staff at the University of Minnesota in 2005 as an assistant athletic trainer and primarily provides care for the women's volleyball team. She was promoted to associate athletic trainer in 2018 and currently supervises the athletic trainers for men's basketball, women's basketball, and soccer. A native of Brooklyn Park, Ronni earned her undergraduate degree in 1999 from the University of Minnesota with a Bachelor of Science in Kinesiology. She was a student athletic trainer in an internship program with men's intercollegiate athletics from 1997 to 1999 and became a certified athletic trainer in April 2000. After completion of her undergraduate degree, she was a graduate assistant athletic trainer at Auburn University, where she worked under the Houston Clinic Kenny Howard Athletic Training Fellowship. Ronni earned her Master's of Education degree in Exercise Science in 2001. Following the completion of graduate school, Ronni started her athletic training career working at the University of Wyoming with volleyball, wrestling, and swimming and diving. After her departure from Wyoming in 2004, she worked in Louisville, Kentucky for the Kentucky Orthopedic Rehab Team for 1 year, prior to initiating her time at the University of Minnesota. Additionally, Ronni has served as a board of certification examiner for the athletic trainer certification exam, previously served 4 years on the executive committee of the MATA from 2010 to 2014, and is currently the president-elect until 2026. Then will serve 2 years as MATA president from 2026 to 2028. She is also on the MATA Honors and Awards Committee. She has worked various USA Volleyball and Junior Olympic Volleyball events and was the athletic trainer for the USA Women's U20 Women's National Team that competed in the 2017 FIVB World Championships in Mexico. She is a member of the NATA and MATA. She holds certification in Graston Technique M1 and M2, is trained active release technique lower extremity, and is a certified kinesiotape practitioner. She resides in Rogers with her husband, Chris, and sons, Benjamin and Quinn. Welcome, Ronni.
That was, yeah, thank you. I've never actually heard that read out loud, so thank you. Yes, my name is Ronni. I work at the University of Minnesota, primarily with volleyball. I've been involved in college volleyball at the Division I level since 2001, which is ironically the first year that we went into rally scoring. The NCAA moved from side-out scoring, which was the traditional way to score volleyball, to what we now know as rally scoring in that season. And I had zero experience with volleyball. I had never played the sport in my life. I am not very tall, so it wasn't a sport that was something that I did. I actually ended up with that job. There were two of us hired at the same time. She is now a very good friend of mine named Shanda. She and I were both coming from grad school. She was coming from North Carolina. I was coming from Alabama. She got there first, and she chose her three sports before I did. So I have volleyball, wrestling, and swimming and diving. So I knew nothing. I didn't know we changed sides. I didn't know how many points they scored. I didn't know anything about the sport. And luckily, I had some very incredible patient people at Wyoming that helped me out quite a bit. The first game, everyone moved to the other bench, and I kind of stood there looking absolutely lost. So thankfully, I was not televised. And then to come back to Minnesota as my alma mater was an opportunity that I did not want to pass up. And then 20 volleyball seasons later, here I am. So I will share my screen and we'll start with women's volleyball. We'll go back here. So I've been lucky. Minnesota has had a lot of success, and obviously I know a lot about the women's side of the sport. The men's side is gaining popularity, especially in Minnesota, with boys volleyball now starting their first official season as a high school sanctioned sport in the state. There has been boys volleyball around the country, especially on the West Coast and on the East Coast, and there are some very good collegiate programs as well. I recently was in Paris for the Olympics watching primarily men's volleyball. We have a former player that is married to a Canadian men's national team player. So I think volleyball is an incredibly dynamic sport to watch and really has evolved into probably one of the most popular sports, men and women, to watch when it is on TV. So obviously the introduction happened. We'll go through what NCAA Division I volleyball and high school volleyball. I'm going to talk a little bit about how we prepare for preseason and what our year looks like as we go through that. Some injury and illness management things, and then some questions and discussion if anyone has any of those at the end. So as of right now, the NCAA, as of the 2024 season, there are approximately 346 NCAA Division I women's volleyball teams in the country. They estimate around 480,000 girls playing in the high school level. And then the club system is really where there is a huge amount of young people playing volleyball, both through USA Volleyball, AAU, and various other organizations. So USA Volleyball estimates about 300,000 female youth members at the recent AAU junior team championships, about 4,600 teams. And then really professional volleyball for women has exploded. There have been leagues over in Europe and Asia for many, many years, but now we are in the United States again. There are currently 2 pro leagues in the United States. And in addition, so Love Volleyball, which is League One, and then the PVF. So, oh. In terms of men's volleyball, currently for this coming season, women's volleyball at the NCAA level is a fall sport. Men's volleyball is a spring sport. So they are currently in their competitive season right now. There are 28 Division I men's volleyball teams. So there is a huge disparity in terms of how many schools offer Division I volleyball for men versus obviously on the women's side. The Minnesota State High School League sanctioned volleyball for boys, and this will be the first season for the spring. The sport was actually approved in May of 2023 as an emerging sport. Our former head coach, Hugh McCutcheon, was a big part of that as well. He obviously coached men for a long time, including our national team, which won gold in Beijing in 2008, before he transitioned over to the women. So he has a good passion, again, for boys volleyball and was really instrumental in getting that to the table. This year, they'll have 85 teams this spring competing in one class across the board. The first actual season on record was 2018, and that started with about 38 teams through 22 schools, including JV and varsity. So just in the last 5 years, we have really increased that offering. And I think what's really cool about volleyball is that it can attract people from all different areas of the state. It can be not only the tall individuals, but on the defensive side, there can be some kids that don't necessarily have the height. And I think we see a great representation of diversity across the sport as well, which is something that I think is incredibly beneficial for volleyball. It gives a lot of people that might not have played a high school sport an opportunity to compete. In terms of USA Volleyball, our data from the 2022-2023, about 78,000 boys are participating at the youth level. Obviously, that number, again, increases every year, especially as people are getting exposed to it. So I'm going to kind of switch to talk about what it's like for us in the Division I college setting. if you've paid attention to that in the last couple of years on the women's side, we have set some incredible attendance records. There's schools like Hawaii and Nebraska and us and Wisconsin and Penn State and Texas that are always in those upper echelons of attendance. But recently we've had volleyball games played in a football stadium and with over 100,000 people watching live. Every time we're on national television, our numbers are skyrocketing. So there's a very good market for volleyball right now, and I'm really excited that the NCAA and college volleyball is taking advantage of that. In terms of the equipment, obviously the knee pads, we use a lot of ankle braces and tape, arm and leg sleeves, especially padded sleeves as our defensive moves get more dynamic. We get a lot of stuff that happens to the elbows and everything, so we start investing in sleeves like that. I believe heavily in foot orthotics, especially custom orthotics. I think if we can take care of the feet, that saves us a lot of issues, especially up the chain with the ankle and the knee and the hip and low back. So every year we have a orthotist that comes out and fits all of our players for custom orthotics. They have one for their court shoe and one for their training shoe. And it's a great opportunity. I think it is costly, I would say. However, I think our return on investment is that it does keep at bay some of the things that we might experience. That the commercial shoes were a Nike sponsored school, so we use Nike. If you ever look at the insoles and the construction of the shoes, they don't give much effort in the insole section. So I think it's a worthy investment on our end. The fueling and hydration, we have an amazing nutritionist, a dietitian named Haley, who really does a lot of education with our athletes regarding fueling and hydration. And then medical supplies such as tape, padding, and braces. I'm not a heavy modality person, but we do have some, everything from BFR to electric stim to the complex units and all those kind of things. So we travel with as much of that as we can. And then I also get to be the equipment manager on the road. So I bring all the extra jerseys and knee pads and braces and anything, spandex, anything else that they possibly could need. So what I have a picture of in the bottom left is a trunk that we have about 5 of these that is filled with just medical stuff. So that's kind of an indication of how we travel. And luckily for us, we travel a lot of charter flights, so our weight isn't much of a thing. The picture on the top left is the amount of tape I'll bring on a weekend. So this would be a 4 practice, 2 match weekend. We'll leave on a Thursday, play Friday, Saturday, come home Saturday night. I either tape probably about 90% of our players. So out of the 18 we had on the roster, I tape 15 for every practicing game. And then all the other extra tape that we bring along. So this is actually when I was packing and I counted out everything I needed, I took a picture. So that's what that looks like. And then what it looks like when it's actually packed inside the trunk. So for our student athlete side, obviously, we do a pre-participation exam and an annual medical review every year when they're incoming student athletes the first time they're on campus with us. That exam is a little bit longer and more intensive. Once they are established student athletes with us, then we just do an annual medical review. However, I am embedded with the team all the time, so really I am aware of everything that's happening with them. So the review is just a way for us to check up on things, make sure that there aren't any lingering problems that might fall through the crack. We acclimate our new student athletes. It's very common. Volleyball for us is a fall sport. That's when our competitive season is. So most of our athletes, if they're new freshmen, are actually coming in January of their senior year of high school. So they'll graduate early in December and come on campus and enroll in college that January. That allows them to train with us for about 6 months prior to us getting into our competitive season. It doesn't work for everybody. It is a choice that they get to make. We don't pressure that. But for example, this year, out of our 4 incoming freshmen, 3 of them are already here on campus, and 1 will come to us in May. So that helps for them. And if that's the choice they make, then we encourage that. There's obviously a lot of paperwork, consent forms, and all these kind of things that we make sure we explain to them and they have an opportunity to read them. We obviously want to do any medical clearance issues. So if they're coming in with a problem or some type of injury or surgery, we have them in front of our team physicians to make sure that we have everything that we need to get them up and running. And then we review medications and supplements. We have to abide by not only NCAA, but a lot of our student athletes in volleyball are involved in some type of pipeline program with USA Volleyball. So they're also subject to the WADA doping and drug testing rules as well. So for us and our physicians and our drug testing individuals, we have to be very much communicating about what medications and supplements they're taking, because even things that are prescribed for them may not be allowed to be taken during a competitive season or at all. So we talk about that quite a bit because we don't want somebody to test positive. And then our athletic performance staff, I have to say that I think personally, I have one of the best strength coaches in the world. Sarah Wiley and I have worked together for 20 years. She's been at the university for 30. And she and I work incredibly closely together in terms of getting the athletes ready and kind of where we're at as we head into our preseason. So, what does a volleyball season look like? I'd still get asked to this day, am I only busy in the fall? Actually, the fall is not very busy for me other than travel. My busy time is right now through the end of May because we are not playing many matches. However, we are training at a very high level. So I'll start in our preseason, which for us is the beginning of August, up until we play our first match. And that varies depending on our schedule, but it's about 20 days. We have unlimited practice at that point because they're not in class and we haven't started competing. We typically practice in a 3-day on, 1-day off cycle with about an hour light practice in the morning. They get a break. And then we do a 2-hour practice in the afternoon. Things have changed on that part. When I first started college volleyball, our 2-a-days were 2 3-hour practices with about an hour break. So we were on the court about 6.5 hours a day. And then they also lifted. Mind you, when I started at the U again in 2005, we did not have air conditioning in the PAV at that point. So it was also very, very hot during those time periods. But we have changed that. Our practice hours are very intense, however, not as long as they once were. We have unlimited contact hours, which means we just basically can practice and do. So they have team meetings, they'll have weightlifting, they'll have individual sessions, things like that. We are required to give 1 day off for every 7-day cycle. We choose to do more days off just because it's a lot of volleyball and we're already training all year anyway, so we don't have to do a lot of acclimation at that point. We practice weight room, really a lot of training on the court at that point. Once we hit our season, which is typically our first match, or they start school through the end of November. So our last conference matches are the weekend of Thanksgiving. Our non-conference is the first 3 weeks, about 8 to 10 matches. Over 3 weeks, we travel, we do some things. Some of those matches are televised, some of them are not, but usually the trend has been like we played in a big showcase that's on TV. We get primetime television, and it's usually select teams. You get invited to those things. Our conference is in the Big Ten. We have 20 conference matches, home and away, so 10 home, 10 away. We do not have a conference tournament at this time, so we just play our regular season. And then obviously our automatic qualifiers, whoever wins the conference. And typically there's about 6 to 7 to 8 teams, especially now that we are up to 18 teams in the Big Ten that get at-large bids to the NCAA tournament. Speaking of that, it is similar to the basketball tournaments where we have 64 teams, there's automatic qualifiers, and then at-large bids. It goes over 3 weeks, so 3 rounds of 2 games each, so 6 games to win the national championship at that. During this part of the season, we're in 20 hours a week. The NCAA, we practice for 20 hours after our first match, so they get some time off. They're also going to school. Any of our contact has to be within that 20 hours. Medical is exempted from 20 hours a week. So treatments, massage, anything that we do that is for a medical reason is not counted as part of that 20 hours. So all the work that I do with the athletes for injury management and prevention, I get to do that without counting hours on them. We again get 1 day off for every 7 days. And most of our time is practicing in the weight room. Each player gets a 1 hour massage body work, 1 hour a week. Training room stuff and things like that. Our off season, we generally have 2 off-season periods. One is from mid-December, so the end of the NCAA tournament, through Martin Luther King Day in January. They're home. We don't have school. They usually leave and go home. And then we have another period, end of finals in May till about the first week of June when they come back for summer school. We send them home. We do not practice. We encourage them not to practice. They do get some voluntary weight room activity, what we consider active recovery. So it's usually body weight circuit things. They're not lifting a lot of weight, and they're really taking this time to let their body recover. They go home for that break in May. They go on vacation, do whatever they want. They're off completely. And we use a program called FIT, which sends weight room programming to our student athletes based on what they have available to them at home. And then right now we are in spring volleyball, which runs mid-January. Um, right now through the end of April, we get 4 competition dates. However, we have travel restrictions on those. I think we can't leave more than 300 miles from campus. We can't fly anywhere. With the exception of every 4 years, we can go to Hawaii or a foreign tour. So we've been to Hawaii several times. It's great. We train, we do stuff over spring break. And this past year, we just did another foreign tour in May. We were in Turkey, Slovenia, Italy for about 14 days over May and June. So we won't have another foreign tour again until another 4 years. Either we go during spring break. I've been to Japan twice on spring break with the team, or over to Europe are the most common things to do with that. Our practice hours, January through March, we get 8 hours a week, which is where we are right now. Once we get back from spring break, we move into that 20 hours a week again, similar to the fall. Our contact hours within that 8 or 20, we have to have flex days. We typically give them at least 2 to 3 days off a week during this period of time. So right now we don't have much on the weekends. And if we do have one of those 4 competition dates as we move into April, usually it's just one day. So like a Saturday, and then they'll get that Sunday off as well. So a lot of practice, weight room activity. This is our heavy weightlifting time and recovery. And then moving into the summer, June, July, typically it always is voluntary, meaning that we don't mandate, we can't take attendance. They're here. Most of our players stay here on campus and train. They might go off and do USA volleyball stuff for a little bit. We're taking care of some injuries, just really kind of getting ready for the season. It's voluntary. They don't have to stay here. Some go home for a couple weeks and then come back. They can lead their own practices, captains types practices, and they can come into the weight room and we can supervise and lead that activity, but it has to be student athlete directed. So that's what our seasons kind of look like as we go through college volleyball. In terms of medical management, volleyball is considered a limited contact sport. However, that's with other people. They do have a lot of contact with the floor and obviously the ball they hit. We consider a lot of repetitive overhead and jumping activity. And the most common place that injuries happen is in and around the net, either from contacting somebody on the other side or your own player. There's a lot of, usually 6 people at the net, 3 on each side. So it's a lot of moving parts in that area. We have learned that a lot of our positional players can be more prone to certain injuries. So we separate them down by our middle blockers, our pin hitters, which is our right sides and outsides, our setters, and then we have our defensive specialists and liberos. So they kind of each have their own little quirks as to what they get in terms of injury. In terms of the shoulder, obviously the foremost common that we see based on the NCAA surveillance stuff that we submit to, a lot of rotator cuff tendinopathy, sprains and strains in the shoulder, glenohumeral instability and labral damage. This is actually quite common. Most of our athletes come in with this type of injury, and we generally don't treat this surgically unless it becomes unstable or so problematic that they can't continue. But it's very common for us to do MRIs on the shoulder and find that they do have some labral damage. There's a thought process that we believe this is a training adaptation. In order for them to hit the way they do, they have to stretch the shoulder in certain ways. So usually it's one-sided on that side, and they typically had it for longer than we're just seeing it. And then obviously some impingement, especially with the bicep tendon. Ankle, lower leg, obviously sprains by far. An inversion type ankle sprain is by far the most common ankle injury that I'll see. Second to that is probably our stress injuries, especially in the tibia, fibula, and midfoot area. We get a little bit of Achilles tendinopathy, not as much as I think other sports get, but we do see that. And then plantar fasciitis, which is my least favorite thing to deal with in the foot. Knee pain, far by and large, patellofemoral pain syndrome we get, and then with that some patellar tendinopathy. We see a lot of maltracking type things. A lot of our athletes, especially when they're very tall, their growth spurts were quite significant. So we'll see just some very interesting knee mechanics with that lead to some patellofemoral pain. We do obviously see the usual ACL, MCL tears and meniscus injuries as well. And then the lumbar spine muscle strains, we see a ton, especially in our young freshmen, muscular imbalance, specifically with the glute med. That is one of the first things. We actually have Club Med, which is Club Med, meaning Club Glute Med. So we have a whole group of people in the weight room that have a special program where we are addressing a lot of that glute med and that gluteus imbalance. They overcompensate with their quads and some other in their low back, and they leave out that section. So when they're jumping, a lot of that is being absorbed in other parts of the body. And so we work heavily to correct some of those imbalances. We will occasionally have the disc injuries and the spondy as well. Typically, we try to catch those early and prevent them as much as we can. One thing that I think a lot of athletic trainers don't do a lot of anymore, but we try to do, especially when we have new athletes, is we watch them. We watch how they move. We watch their wear patterns on their shoes and equipment. I look at their shoes all the time. I look at their knee pads. Are they down on one knee versus the other more than other, which a lot of our DSs do? That can lead you to say like why they have pain there, and we can put some padding there. We look at their compensation patterns, especially our hitters that are running at the net. Are they landing on one leg? They should be trying to land on two if at all possible. If they're a 1 foot landing, we try to correct that sooner rather than later. And then we obviously see the training adaptations. Usually they have a greater external rotation on their hitting arm, limited internal rotation on that arm. We see those and we don't necessarily try, we're going to have a limited internal rotation. We intervene if it becomes a problem, but if it's significant enough, we might intervene early. It's a very different motion for them to hit at the net versus serve. So sometimes they might only have pain on their serve, which indicates an internal rotation problem because they don't have great follow through. So we might intervene on that end. And then we make the decision if it's a surgical versus non-surgical. And I will say over 20 years, we are trending more towards the non-surgical management, especially in our upper extremity injuries. And I like that because I think the rehab is really advanced. And I think that's a good way to manage those injuries if we can. This slide just shows these are some of our players. That shows, for one, we have the benefit of great photographers. So I love looking at the pictures they take because it does give me a lot of feedback as to how they move as well. So the pictures I picked, the one on the top left is a outside hitter of ours named Dolly Santana. She's one of the most powerful hitters that I've ever seen, but technique-wise was absolutely horrendous when she got here. However, this is her during her senior year, and this is an aerial shot taken from above. What I like about it is it shows a great how they hit in terms of their shoulders are back, their hips are facing forward, and she's going to land on 2 feet and she's going to hit the ball at the right height. It's just a great picture that shows that rotation, especially in the trunk when we look. The next picture is a player named Adriana Nora. She was a right side or opposite hitter. I like this picture for a few reasons. One, it shows her hitting very well. She's going to land on 2 feet. Her shoulder, she hit a great line shot, which is she didn't rotate as much because she's hitting down the line. But looking at the other player, she's going to land on 1 foot. Her hips are actually turned away from the ball, and she misread the block as well. So that's why the ball went past her. But it just shows you, first of all, she's very high up over the net. But also, you look at how she's going to land, and this is what we would look at and say, hey, you're twisted too much. So she was probably running over to the side. The one on the right is Kate Ardias. She is a current player, but this also shows some of the mobility that is required. She's a back row only player, but look at how she has to move to play and hit that ball. So she's digging. She has her hips and everything. So we like looking at these pictures because it shows her ankle mobility is fantastic. And she probably dug that ball well. The one on the middle, I'll go to Paige, who's our middle hitter. Again, we look more at, I like to see how she's going to land. So this particular one, she's probably going to land on 2 feet because her legs are together. She's running a slide shot, which means she came from behind the center and had to rotate. And so we like looking at those pictures because she was actually a terrible lander for a long time. So we spent a ton of time watching her land and hit, and this was her senior year, so she had made some really great adjustments. The shoe picture is just an example of a wear pattern that we would see. So this was a training shoe. This individual, as you can see on the right shoe, oh, that's the left shoe, I'm sorry, is quite worn on her heel compared to her right. So this gives us an idea that she probably is striking harder on her left. This particular person actually had a heel bone bruise at the time as well. So we were like, okay, well, this makes a little bit more sense if we looked at her shoes. So we take all of that information as we're looking. We actually made a nice heel cup for her and watch that and she obviously had some glute problems that we addressed as well. All right, thank you. That's all I have for information. I'd love to take questions if you guys have any or if there's time.
Thank you, Ronni. All right, everybody, if you have any questions, use the chat to ask those, and I will read those aloud. Those will only be visible to our panelists, just as a reminder. I guess, Ronni, I'll ask you a question. So with boys volleyball becoming a new sport in the high school setting this spring, do you anticipate that we might see new or different injuries from boys volleyball than we do in girls volleyball?
Yeah, obviously the net height is different in boys and girls. And also, I think one thing that's important to remember, just like when we saw girls hockey kind of explode on the scene, most of the people on this probably don't remember that, but um, they don't quite get exposed to the training that girls do at a young age. So looking at it from that perspective, girls volleyball players are typically starting this now, 8 and 9, 10 years old, whereas boys volleyball are really coming to this a lot later. When you see this new high school season, you're going to see a lot of boys that are doing it for the first time. Maybe they've played some stuff in the backyard or some casual stuff, but in terms of actual training, they are far behind what is offered for the girls right now. I mean, if you look at the big club systems, there's really, I think, 2 clubs in the big systems in Minnesota that are having competitive boys teams. So, yeah, I think we're going to see a lot of that. Also, they don't quite know as we get into bigger competitive matches, they're gonna, like I said, the technique will start to show, so that training effect will happen. So we saw some of those landing mechanics. I think we're going to see an increase in ACL and ankle. I think we're going to see an increase in low back issues, just because they're just, again, not exposed to the sport as long, and a lot of the injuries that the girls are experiencing younger in their club season, and we're going to see that in the boys' high school season. So it's a really interesting dynamic as well. So,
Thank you.
mhm.
All right, we've got a couple questions here. What, if any, biometrics are being utilized in collegiate volleyball?
Yeah, I mean, if you have the money, we can spend it, right? We use we use Catapult right now. We did use Zephyr, which is, I believe that's the biometric systems you're talking about. If that's not, you can correct me, but Zephyr was a system that was designed and supported by Medtronic. That is no longer supported, so we did switch to Catapult. And luckily for us, football invested heavily in Catapult prior to us joining in on that, so we didn't have to do a lot of the startup. And then we have a fantastic tech coordinator named Sankey, who not only stats our team, but he created an app to take all that raw data from Catapult and put it into a usable format that Sarah and I can look at. And we get a lot of great information from that. We get a lot of load, jump counts. If you relate that to a pitch count in baseball, that's kind of how we monitor how many jumps. So now we've used either Zephyr or Catapult for about 12 seasons. So we have a huge database, and there's other schools across the country that are doing it, that we pool our data together. That's all been de-identified. We know that an average middle blocker might take 300 jumps. So if we see a middle blocker taking more or less, we can kind of gauge where they are with that. And we're starting to get some norms that we can pass down to the younger groups that say, hey, you don't need to have an outside hitter hit 700 times in a weekend. Similar to how baseball really invested in how they manage their youth baseball pitchers, where you can't throw at certain levels and you had how many days off you have. Volleyball is really behind on that. So hopefully, as we get more of that data published and more information out, we will start to see a shift in those youth programs not overtraining their players, because that's still a huge problem for our female and males are going to find that out pretty quickly too, because there's really not a regulation of that right now for volleyball.
Great, thank you. Another question, what is your opinion on over-the-counter shoe inserts versus custom orthotics?
Yeah, I think anything is better than what comes in the shoe. I love Nike, been a loyal Nike person for about 25 years. However, probably if you really deconstruct a shoe, especially, and there's a big lag between, we actually train or play on our court shoe is a basketball shoe. Why we like that is the heel cup is deeper. If you look at a volleyball shoe that's made specifically for volleyball from Nike, that's where my expertise is going to lie. The heel cup is very shallow in terms of you just basically can slide your foot in and out of that. Whereas a basketball heel actually comes down into the shoe and holds the heel in a neutral position, which we like better for a lot of our players. Their feet move around a lot inside the shoe. So I think the other part that I like about doing any kind of orthotic is you actually have to look at their shoe size. Many, 99.9% of the incoming freshmen, we move their shoe size up when they get here because they've been playing in the same size since they were 15, 16, because they're like, oh, I was done growing. Well, your feet change, and especially in the court shoe, I mean, when you're landing, your foot spreads out. So we want to make sure whatever shoe we're putting them in allows their foot to function to the best of its ability. That's why we have different court shoes, we have different training shoes, and even a counter off the shelf insert is usually better than the very thin one that they put in the shoe itself. So I encourage if you're going to invest in anything, that would be something. If you're going to have a $300 shoe, get a very good orthotic to go inside that shoe.
And then another question kind of going off of that, somebody else asked, do you have an orthotics brand preference?
Whatever Steve Patterson and orders for me, I guess. Steve is our women's basketball athletic trainer that handles all our inventory. So, I mean, Alex and Kyle probably can better answer that. Maybe because I use all custom right now. So we use, I mean, I'll shout out to Todd Westlake at Westlake Orthotics. He's the guy that comes out with his van, molds all the feet, and grinds our orthotics down. So I guess Kyle and Alex might be able to answer that if you guys know what you guys use as well.
Yeah, we've used foot management as a custom orthotic. They kind of give you the box. They have you step into it, which like kind of forms to your foot a little bit, and then we've sent it off. We've really enjoyed them. I've also used foot levelers in the past. They seem pretty good as well. They both come back with like a leather topper on them, so they wear pretty nicely. Um, and then for over-the-counter ones, yeah, we use kind of like the green top ones. I forget what
Ben
they're
called.
called or
I think,
anything, but
yeah.
um, yeah, I can't say I have a ton of brand loyalty, but foot management has done us pretty well in the past.
And I just want to point out, remember, my team is only 18, well, 15 to 18 players. So the reason I do custom orthotics with Westlake is because and for the most part, once we have the mold, we just redo the orthotic. So once we have that, we keep that mold for their whole time. Whereas larger teams like track and others, sometimes you have to do more of a cost-effective and faster way. The orthotic process is, and everyone has kind of different feet. So it's getting fitted, it's getting them adjusted, all those things that go into that as well. So.
Great, thank you.
Mhm.
It looks like there are no other questions, and I messed up earlier. If everyone could use the Q&A section to ask questions, we did have people do that versus the chat. That would be easier for all of us. So thank you to those who already did that. And then before our next presentation, Ronni, if you wanted to give a little talk on the PAC.
Yes, as obviously I've been involved with the MATA for a long time. I'm passionate about advocating for athletic trainers in the state. And with that comes some legislative action that we have to be constantly vigilant on. So I think it's important. I know, especially as young professionals, that's not always your top priority. However, it is so vital to our success and to continue to advance our profession and be able to let us work at the top of our scope. So as a gesture of that, I'm donating my honorarium for this talk tonight to the PAC as well. So like I said, I think it's important that you see us lead by example. So please, if even $10, it's a worthy cause. And again, we do use that money directly to our actions to benefit athletic trainers.
Awesome. Thank you so much, Ronni.
You're welcome.
All right, our next speakers are Alex and Kyle from the U of M. Kyle Zeiszler joined the health and performance staff at the University of Minnesota in September 2022 as an assistant athletic trainer working with track and field and cross country. Originally from Bismarck, North Dakota, Kyle attended Northwestern Health Science University School of Massage from 2010 to 2011, finishing with a certificate in massage therapy. He then attended Minnesota State University Mankato and graduated in 2016 with a Bachelor of Science degree in athletic training. Zeiszler returned to Mankato for graduate school, completing his Master of Arts degree in sports management in 2019. While in grad school, Kyle worked as a graduate assistant athletic trainer with track and field and cross country from 2017 to 2019 and covered various sports as an intermittent athletic trainer from 2016 to 2017. Kyle worked as an assistant athletic trainer at Sam Houston State University from December 2019 to July 2022 with track and field and cross country. He also served as an athletic training education preceptor during his time in Huntsville. Zeiszler is a certified athletic trainer, a Minnesota State licensed athletic trainer. He holds certification in massage therapy, Graston Technique M1, blood flow restriction therapy, dry needling, mental health first aid, and reflexive performance reset. And Alexandra Fruetel joined the health and performance staff in the University of Minnesota in August 2022 as an assistant athletic trainer working with track and field and cross country. Originally hailing from South St. Paul, Minnesota, Alex attended Iowa State University and graduated with a Bachelor of Science degree in athletic training in 2015. While in Ames, she worked as a student intern for 2 summers with football. She then attended graduate school at Tulane University while working as a graduate assistant athletic trainer with indoor and beach volleyball, graduating with a Master of Liberal Arts degree in 2017. From there, Alex transitioned into a full-time athletic trainer at Tulane, working with volleyball, bowling, women's golf, and track and field / cross country until 2022, along with supervising graduate assistant athletic trainers. Additionally, Alex administered summer camp medical coverage, student athlete pre-participation exams, and inventory management. Fruetel is a certified athletic trainer and a Minnesota State licensed athletic trainer. She holds certifications in integrative dry needling level 1 and phlebotomy/IV access. Alex currently resides in West St. Paul with her significant other Darius and children Avery and Elijah. Welcome, guys.
Thanks for having us.
Thank you.
Let me share my screen here and we can start with that. We were asked to kind of talk about what it's like being a track and field athletic trainer. What happened? Sorry. We're asked to talk about what it's like being a D1 track and field athletic trainer, and then some of our expertise on lower leg injuries, particular and shin splints and kind of stress reactions. Both me and Alex work at the University of Minnesota. I primarily work with the distance and throws groups, and she works with the sprints and jumps. We don't have any financial relationships or disclosures or anything like that. But here's us at Big Tens last year. So some positives and negatives with being a college track and field athletic trainer is we get to work with elite athletes on a regular basis. We have multiple Olympians on our team, and ones that are hopeful for the following years. We have a number of very talented sprinters and distance athletes and throwers. Another thing that I find really fun is that we have a bunch of international athletes from all over the United States, all over the world, from Nigeria, Greece, Brazil, Trinidad, Tobago, the Bahamas. And it really lets you meet a bunch of people that you maybe never would talk to. And yeah, it's great. Um, Another great thing is the travel opportunities, whereas we don't get to go overseas like Ronnie, but we do get to go to lots of warm weather places in the United States. Generally, we're going to California, we're going to Texas, we're going to Florida. Oregon is going to be a lot more common and generally host nationals. So we get to see a lot of Eugene, which is always fun. Other things is the U has really great access to doctors and imaging, which makes it much easier on us. Both me and Alex have worked in kind of that mid-major D1, where you don't have as much access. And it's definitely uh, nice being at the U where we have doctors in uh, our training room on a daily basis. And I've found myself using a lot more of our gen med doctors, especially for shin pain, than I have our orthopedic doctors. Also, having fast access to MRIs definitely affects how I treat lower leg pain, um, and what I'm willing to kind of push and not push, depending on, say, um, when I was down in Huntsville, maybe couldn't be as aggressive on certain things. Um, let's see here. Also, the flexibility uh, that having another athletic trainer working your same sport is extremely nice. If me or Alex needs to step away to take a athlete to a doctor's uh, visit or something like that, it makes it very easy to do. Um, yeah. Alex, do you have any other positives or?
No, Kyle kind of touched base on all of them. I think the biggest one besides, us working with elite athletes and having that fast access to the doctors and imaging, I can't stress enough how nice it is for us to have each other. Kind of like Kyle said, like we're able to step out or even, as I talk about some of the challenges, we can kind of step away and just take a break if we need a day just to, take care of personal things. But he pretty much touched base on every thing that was positive. So I'm gonna head and talk about our challenges that come with track and field and cross country. The first one being long hours. So we don't get the luxury of just having one practice time. We have multiple practice times throughout the day. Um, so we could start a practice at 10 a.m. and then our last practice could start at 3 p.m. So it makes for a really long day, and how we kind of schedule it is we have treatment after practice available to the athletes. So yeah, so the only fortunate days that we get are, kind of condensed are our off days or their easy days, where they're just lifting or they're just cross training, depending on what event group they're in. And so kind of to piggyback on that is that high pressure environment, because we do work with so many athletes and so many event groups. There is a lot of pressure to have everybody practice all the time. Just because the sport of track and field and cross country is very hard. It's very hard to take time off. And so if we lose a day of training, it can make things difficult for like their training cycle or their competition season. So a lot of times Kyle and I are talking a lot with the athlete and the coaches in order to maintain that, cohesive treatment relationship so that we can treat the injuries, but also so they can get back to their training as soon as possible. In that, the next one is the risk of athlete injuries. So fortunately and unfortunately, we don't get the big injuries. If we do get the big injuries, it usually means they're out for the season. we kind of deal with the maintenance and the chronic injuries, which can be time consuming, but also for the sport of track and field, because we don't have that luxury of always taking a break or taking a complete off day when we're training or competing. We really have to work with the coach and the athlete to find a recipe on how to deal with some more of those chronic or maintenance injuries. And a lot of that depends on what point they're at their training cycle or the season. And it kind of just is risk versus reward. Like sometimes we get the luxury of, taking the time off so that they can heal a little bit better, but sometimes we don't get the luxury of that. And so it just makes collaborating about treatment plans a lot, I guess, more difficult, but also I would say that's kind of like the fun piece of our job because it's like a big puzzle. Then kind of segueing into that, balancing multiple athletes' needs. So between Kyle and I'd say at least we have 40 athletes each. And obviously working the events that we do, they come with different challenges. So like Kyle said, he works the distance and the throws for men and women. And then I work the jumps and the sprints for men and women. And in my side of things, sometimes I don't get the luxury of doing treatment, which is kind of unfortunate. But because we're trying to balance so many athletes and each needs are different based on that athlete, I spend a lot of time talking to the athlete and the coach to kind of determine what they're looking for to get out of their season or what the expectation is. And so a lot of times I'm talking with each athlete on what we need to do for treatment, but I would say that for Kyle and I, we don't treat each athlete the same. Some athletes get more treatment, some athletes get less treatment, some athletes only get treatment when they're on the road. It kind of just depends on that athlete, and balancing all of that can be really challenging when we're seeing, 17 people each in a day. So that's another challenging part. But it makes it fun sometimes. And then the last one is just travel and the time away from home. While Kyle mentioned it's super fun, the places we go, we get to go to a lot of warm places and see a lot of great track competition. It's a very long season. So how we kind of think about it is there's a cross season, which Kyle just does for the men and the women. So he travels all of fall. And then we have our indoor season, which we just have a women's indoor team. We don't have men. So this year I took the bulk of that. And then our outdoor season, Kyle and I kind of tag team together. So sometimes we both go, depending on how many athletes we take. And then sometimes I go one place and Kyle goes another place. And then when we get into our championship season, excuse me, we're gone for anywhere between 5 and 7 days. So if it's indoor Big Tens or outdoor Big Tens, it's usually 5 days. And then when we do post-championship season, so NCAA regionals and NCAA nationals, it's 7 days. So it's a long season from, September to June. But like Kyle said, and one of the positives is that there's two of us. So if one of us does need a break, or, we both have significant others and families, like we need to take time off just for a little bit, just to recharge. We do have that, that possibility of doing that, but it is long travel and there's some trips we both got to go on. So, yeah.
Another difficulty I would say that we didn't put on here is we do have 5 coaches pulling in 5 different ways. So you have to very much realize who the athlete is working with and how they will interpret certain things. And one coach may want to be more aggressive on something, one will be a little less aggressive. And you have to have a lot of those conversations about are we pushing them too hard? Do we need to pull back? Or no, stop. Like they don't need to be scared of this, that you can push them harder on these things. And we have to be able to push and pull. And yeah. So talking about shin pain is extremely common, and it's common across probably all sports, but especially in track and field. I mean, anyone who runs and jumps is likely to experience some form of shin pain. The most common is that medial tibial stress syndrome, and that is a big um, spectrum of what that can be and what that encompasses. When we talk about it in this presentation, I'm mostly going to talk about like the shin splint, medial tibial stress syndrome as kind of the lighter side of things of uh, kind of more general shin pain, mostly that like posterior tib pain from overwork, overuse, possibly some involvement with the foot as well, in its ability to support the arch. But generally just kind of that like kind of beginning of it. As that can progress, it can become a bone stress injury, starting out with kind of stress reaction and then working all the way up to very serious stress fractures that may even need surgery. So it's a wide berth on that of what it could potentially be. And just because it starts out as shin splints or medial tibial stress syndrome, it can very easily progress into stress reactions or stress fractures quite quickly. And it still shocks us sometimes of like, hey, I looked at this last week and this didn't look like much. But this week it looks pretty bad and we need to shut down and get in the pool or jump in on the bike for a while to let this calm down and really being okay with reevaluating things constantly is all you can do. Obviously, um, we do a lot of treatment on these to try and mitigate them, but a big component of this is how um, their training is progressing. So if they're starting or it's getting close to the end of the season, we'll talk more about that. But I'll let Alex talk about some compartment syndrome.
Yeah, so I did actually end up having a hurdler last year who got a fasciotomy of all four compartments. Um, it took a while to get to the diagnosis, mostly because of the athlete, because um she really wanted to run. And so we worked on Kyle, like kind of like Kyle was talking about, like you work on progressions or you work on limits of what you can or you can't push. And so for her, we had to rule out a lot of things. So, right, we're ruling out a stress reaction, we're ruling out an ankle injury. And then the other problem is she would not consistently have pain, or that numbness, or that tightness, or the weakness. She would only have it during hill workouts and when we did a lot of curve work. And so it made it difficult to get to the diagnosis. But I think one thing that really helped was the only treatment that I could do that would give her any sort of relief was dry needling. Obviously, looking back, how you test for compartment syndrome is with that pressure testing. And so essentially, I think what happened when I would dry needle, I would do it 3 times a week, and that would give her her best results. And then at some point, the dry needling didn't work anymore. And so she was like, Alex, I think it's time. And so we were able to talk with our doctors and kind of started that process. And when the numbers came back, it wasn't surprising. I mean, she had been dealing with it since high school, but again, it wasn't something that was super cookie cutter. But if we look back, the dry needling giving her relief, having that tightness and numbness and weakness, and it got worse with exercise. That it aligned, but it was a difficult process to get her to come to, I guess, the realization that we needed to test for it. But now she's on to recovery. She still deals with some of that pain, but it is, I guess, much better. But yeah, so.
Yeah, and we suspected um her having compartment syndrome for a long time before we tested it, but I mean that's the nature of track. Like all of your injuries are overuse things. It's very rare that you have an injury that comes out of nowhere. I mean, most of our injuries are like, hey, I've been feeling this for a while, and I was trying to ignore it, and oh, now I need to speak to you guys about it. And we're obviously trying to catch those things as early as possible, but you also have to realize that part of the athlete's job, especially during competition and practice, is to block out pain. And you have to be okay if you get mad at everyone who comes in with shin pain that they've been dealing with a long time. You're going to be mad a lot. So,
And I think, sorry, Kyle, not to
oh
interrupt.
yeah,
I think one thing also is we don't get the privilege of being at practice. And so a lot of times, like when Kyle, talks about reporting, we are putting a lot of, I guess, responsibility on our athletes to report things to us. And that is hard when you deal with 18 to 24-year-olds. And even if they're not saying anything, we also put a lot of responsibility on the coaches. And sometimes people don't communicate. And so when he talks about we hear things, oh, I've been dealing with it for a while, we would love to be at practice. But again, to one of the challenges of having multiple practice times, we can't be at practice and do treatment at the same time because we don't have a training room at our track. But that is probably one of the more, I guess, other tidbits is we have to rely on the athlete to report, and that doesn't always happen. And so we don't always catch everything right away. So it makes it difficult.
yep, for sure. So kind of understanding medial tibial stress syndrome and that line between stress reaction. Obviously, any athlete who runs and jumps, which is just about all of track and field, short of the throwers, is likely to deal with this. Causes the biggest thing is overuse. So especially that training progression, we obviously are going to see it way more whenever we're coming back from a break. So coming off of summer, very likely to see it, especially that first month, going into January, kind of getting back from the holiday break, very likely to see it. Also, we're getting onto our indoor track, and it isn't very cushy. Also, there's a little bit of a break between indoor and outdoor. That one we see a little bit less of it, especially when we're talking about more that like shin splint kind of muscle pain. Those are kind of early in the season. We tend to see kind of that stress reaction, kind of bone stress injuries starting around the middle of each season and gets worse through the championship, and that adds some difficulty of like how aggressive do we want to be with getting the MRI or whatnot, because if we're able to manage it, maybe give them a couple extra rest days, can we get through championship season before we have to shut down? And doing different things with adjusting their training load can be really beneficial in that way. Some other causes, definitely biomechanical. If people are overstriding in their running gait, it can definitely increase this. Obviously, um, for jumpers, if their takeoff is a little funky or whatnot. One thing is, though, we are not the coaches. We do not understand these sports as well as maybe the top level of like exactly how and when they're supposed to be like that or supposed to be in certain places. So having those conversations with the coaches of like, hey, what do you see? Like, are they doing anything weird on their takeoff or things like that. I do a little bit of gait analysis with my distance athletes and checking for overstriding and see if we can, hey, what if we increase your step count a little bit and get those steps a little bit more underneath you as opposed to out in front of you. Maybe that we can kind of adjust some pain with that. Another big thing, and especially with distance runners, is if they come in with foot or lower leg pain, one of my first questions is like, how old are your shoes? And I don't have like a specific number that they need to be before we replace them, but especially if they're toward the end of their life, I'm going to be like, hey, let's switch them out. Maybe it does something, maybe it doesn't, but it's usually a good alternative to kind of look in that direction. Some other things is lack of recovery. We get this problem a lot of times of athletes kind of going through it's middle of the season, all of a sudden they have this lower leg pain, and our coaches are like, why are they having this? And we're like, hey, do you remember that like week and a half where they were really sick? Like that wasn't too long ago, and that lack of recovery that happened during that time period may have contributed to this. Also, just 20-year-olds are going to be 20-year-olds. Like they aren't all choosing the best decisions every weekend. So making sure that your coaches know that it's not, we're not attacking them every time we're saying like, hey, there's a stress reaction. Like um, it's not always because of their training, but sometimes you need to mitigate different training um, inputs so that they can have some time to recover. Another big one is change in weight. This can happen for a number of reasons. Sometimes people come back and they weigh 10 or 15 pounds under what they did the year previous. This is sometimes due to just overworking. Other times it's due to some eating disorder or disordered eating. So I spend a lot of my time trying to figure out or get people into the people that can figure out if they have an eating disorder or disordered eating, or if they're just got busy and they've been working out too much and maybe they just haven't had fuel, kind of eating as fuel on their mind. So making that conscious effort to figure out why they lost the weight. The other end of the spectrum is sometimes they gain weight. Sometimes we have like a late growth spurt. I know one of our jumpers grew a couple inches over summer, and all of a sudden, like that next fall, he's having shin pain. Well, he's probably a couple pounds heavier. He's stretched out a little bit. Like, yeah, it's likely that his bones aren't keeping up with that added weight, and he may need a little bit of extra recovery or pool workout or whatnot to kind of get back his legs back under him, per se. And other times, athletes gain weight just because over break, maybe they eat a little bit more or whatnot. And that is tricky. We have to work with our nutritionists to try and see, are they willing to even talk about that? Is that something that they want to work on? Do they think it's even a problem for them? And it's definitely a challenge for sure. Alex, you want to have anything to say on that?
Yes. Yeah, so as far as my event groups go, just because I work with the jumpers and the multis who train 5 to 7 events and then the sprinters I don't deal with too much shin pain on. It's I would say it's almost kind of uncommon because they're not on the ground for very long. They do have one mid-distance guy that deals with a decent amount of shin pain. And so the thing about and then the jumpers are kind of like my opposite end of the spectrum is they're really good about knowing their shin pain because I think they just feel it a little bit more because they have to jump. So I would say when I look at my groups, I don't really deal with the sprinters. Um, because they're not on the ground for very long. And then my jumpers do a really good job of taking care of their lower legs because they need them to jump. I would say my one mid-distance individual and then my multis uh dissociate their shin pain, I guess you could say. They don't spend as much time as recovering that. With my mid-distance individual, he more focuses on like, oh, my hamstring. Unless his shins are really bothering him, he's probably not going to pay attention to it. And then my multis, they train 5 to 7 events, so they got a lot of aches and pains that are just a part of being a multi. So when I look at, the shin splint side of things, I almost have to be a little bit more in tune with it just because my athletes don't necessarily pay attention to it. And then by the time they do pay attention to it, it's like, oh, this hurts really bad. It's like, oh, well, that's a problem. So it makes it a little bit more difficult for my athletes, but we do a lot of maintenance things, I think in the fall that kind of help us for the spring, but we'll kind of talk about that in the next slide.
Yeah, some other things. They feel the same. Like when it goes from shin splint to stress reaction, there is not this big increase in pain. Sometimes there is. Sometimes you're like, oh, we clearly need to shut down. But so often, that pain is such a gradual ramp that it's not screaming out to you. So a big thing that we do is check palpation and check to see if that pain is on the bone or off the bone, and what they're more tender with. I'm willing to push medial shin pain maybe a little bit further than that anterior shin pain. If they're having pain straight on like the anterior side of the tibia, we can't push that as far. We're going to need to um, kind of get that MRI a little bit quicker on that one, because it is a little bit more worrisome and the stress reactions there sometimes require surgery. So, whereas that medial side, um, often you can push it a little bit longer and not be punished by that. But also being open and honest with the athletes of like, hey, this is looking more and more like stress reaction. Like if this continues down this pathway, we are going to need to see a doctor about this so that they know, like, hey, like if this is hurting me more, I need to speak up and different things like that. So, so our management and prevention strategies, the biggest one is talking with the coaches and altering practice. It's not the first one we go to, but I would say it's definitely the most important. Alex, you want to talk about how you
Yeah.
did it?
Yeah. So, because so Kyle's athletes with distance, I mean, they're always running on the ground. My athletes don't necessarily have to start out right away on the hard track. Um, Kyle had mentioned we have a very hard indoor track. It is probably my least favorite thing we have, because it makes it difficult for these types of injuries to kind of help us determine like, oh, are you just sore because it's a hard track or is your load too much? But one thing that we do in the fall with the jumpers, Coach Cavia lets me know like on mid-October, this is the day we're going to start jumping. So they don't just, get back from summer and then start jumping again. That would be very bad. They start with plyos and are on the turf. And then I know that once they hit mid-October, whatever that date is, I know, okay, we're jumping. I'm going to see an influx of shin pain, but it shouldn't be, if we get to mid-November and they're shot, meaning their shins really hurt, it shouldn't be that. So then we need to figure out what to do from there. Same thing with my sprinters. Coach Bingo will let me know when the women are going to move to the track. Again, he doesn't start them on the track. This is because they're not adapted to it. We don't assume that they did what they were supposed to do over summer because they're on their own and they don't have a coach. But again, he gives me a date. Again, it's usually October. And he says, this is the date we're on the track. And so that way, when I move through my weeks of October to November, getting ready for the first indoor meet, I kind of know what to look for. And it just helps to acclimate them. And then I know, oh, we're going to see a little bit of influx in shin pain, but it shouldn't be this like big leap. And then for the multi-athletes, because they do train 5 to 7 events, their load is always more. But one thing we do in the fall is because they do a lot of track work because they have to, we then supplement with the pool. And thankfully, we have a pool in our training room. So I'm able to kind of see what they're doing for pool workouts. But each of my groups figures out a way basically to integrate them into a more hard surface. So again, for the multis, they're using the pool because they have to do a bunch of track work. The sprinters will go on the track at a certain point. They don't start on the track. And then the jumpers will start with plyos and on the turf. And then we move to the runway, which is harder. And then they start jumping. So it's this gradual increase because we don't want anybody to get hurt. If we came back in September and they just started out on the track and the runway, be very bad, would not be very good. So.
Yeah, so with my distance crew, obviously healthy, they're going to do the vast majority of their work running outside on the ground. But we are lucky to have 2 boost or Alter G type treadmills that are utilized a ton. I would say there's a lot of them that are running on those things 2, maybe 3 times a week sometimes, especially if they're starting to get some lower leg pain. Also, we do have that pool. They do aqua jog or cross train frequently as well. And when things start to flare up, it's very likely that they're going to increase that kind of cross training. So I may tell Hop or Wick or my coach is like, hey, like this is starting to look a little worrisome. Can we get them a little bit of extra cross training or whatnot? And kind of work on that and figure out like what practices do they really need versus which ones would just be nice to run. There's a lot of times that you can do kind of a easy mileage day, but do it on the boost or do it in the pool or something like that. Whereas if we're getting ready for competition, that speed day may be really important. So maybe kind of biting the bullet on that one, but giving them a little bit of cross training elsewhere can be really beneficial. Obviously, treatment is a key factor, but I would almost relate it to more pain management. Both me and Alex are dry needle certified, so we do a lot of dry needling of posterior tib. Also, just working on the calf in general, working on the feet. I've done a little bit more of a foot analysis recently with the distance crew, making sure that the foot moves well and can kind of absorb the impact of the ground. And I don't know how much it's helped with the shin pain, but it's definitely helped with foot pain for sure. Strengthening and flexibility, working on that posterior tib and ankle stability can definitely be helpful. Working on calf flexibility is absolutely key. So many of the athletes have limited dorsiflexion. I would say if you're looking at the track team, probably 80% of them have restricted dorsiflexion. So they're always on their toes, they're always hopping, they're always moving. So that just gets shorter and shorter. So fighting that battle can be helpful. Proper footwear. We're not super what would I say? Particular on what type of shoe that they wear. For the most part, whatever they feel comfortable with is kind of what the research has said is best. So if they want something that's a little bit higher stack height, awesome. If they want something a little bit more rigid, great. But sometimes getting the orthotic can really help. Some people it is game changing, and others it's like, it's kind of helped maybe. So playing with those a little bit. And then again, that proper diagnosis and frequently reevaluating. You're constantly going to be looking at that shin. Every time I work on it, I'm like, does it hurt on the bone or off the bone? Oh, it's off the bone. All right, we're good. Oh, it's on the bone. How much of the bone is it hurting? Is it like half your shin? Okay, we might not have to worry that much. But is that half your shin this week down a little bit, down a little bit? Okay, we need to start to worry. And we need to start getting you some more cross training. So that can be absolutely vital.
And
Anything?
knowing that, yeah, and knowing that based on each day, it's going to be different because they're doing a different workout each day. And things that we think that might hurt, don't hurt them. Again, what Kyle said, just frequent re-evaluation. Again, we do put a lot of responsibility on them. If they don't tell us it bothers them, then we're not going to either probably ask or we're not going to know. So knowing that it literally changes from day to day, and then also something that we have worked into, our training weeks is we're going to have Saturday and Sunday off for my group. So they're going to get some extra rest, or they're going to have a no impact on a Wednesday. So we have to play with a lot of variables of knowing when it's time to seek, extra providers, or we can manage it. I'd say another thing that we have access to is chiro, so we can get, foot adjustments. Sometimes that helps. And then I don't remember the second one. I lost it. That's okay. But chiro has been a big help if we're stuck on some like lower leg pain. It actually has been pretty helpful. So
All right. Yeah, kind of in conclusion, basically shin pain's really common, but it is manageable. And managing it is kind of key. Um, differentiating between the kind of three that we talked about can be pretty difficult, but especially between kind of shin splints and bone stress injuries, it's just constant reevaluation, um, stuff like that. And then prevention is proper training, talking to your coaches, seeing when we need a little bit more rest time, or oh, they're sick, we need to dial things back a little bit. That may help their shins too. And then also that biomechanic component as well.
All right, we do have a couple questions already loaded up for you guys. How do you manage training load for an athlete with medial tibial stress syndrome during competition season? If the athlete is cross-training to manage symptoms, do they compete even if not fully practicing? And how do you navigate that conversation with coaches?
it's a really great question. I'll go first with the groups that I have. I think I can pull it up because there's multiple in there. Okay, so during season, again, kind of what I talked about before, you really got to work with the coach, because I don't know every training cycle, and I don't know, sometimes a meet that I think is important could be like, no, I don't want them to compete at that meet. We can kind of lose that meet. So again, it's talking with the coach and the athlete, and kind of determining what is going to be best for them, while kind of figuring out how much you can push the limit. I mean, we're doing tons of treatment during season 2, so that's another component to it. And then the second part of that question, if an athlete is cross-training to manage symptoms, do they compete even if not fully practicing? I would say that is totally coach dependent. I know Kyle's going to have a different answer based on the groups he works with versus myself. If my people are fit and can go, they will go. But there's times too where we just get maybe a week or 2 behind and they're not fit anymore, and then they aren't competing. So it really depends at the point of season we're at. If we're close to Big Tens, most likely we're going to do everything to compete. But also if it's a multi-athlete, they don't compete at regionals. So let's say they're really close to making the national meet. Then we might just say we're not going to compete at Big Tens. We're just going to compete at nationals, but it depends a lot on point ranking. There's a lot of different components. So it's not a very easy answer, but that's the best answer I can give. And then how do you navigate that conversation with coaches? Very carefully, as carefully as we can. Obviously, both Kyle and I want the best for our athletes, but we understand like there is a competition